Have you ever wondered why the conversation around reversing type 2 diabetes is not as widespread as it should be? Why, despite living in an era of unprecedented medical advancements, the knowledge about potentially reversing this condition remains shrouded in mystery? Well, that's the enigma we're about to unravel today. It's a well-known fact that type 2 diabetes affects millions of lives globally. Yet the dialogue about its reversal seems to be locked behind closed doors. To understand this better, we've reached out to some of the leading medical professionals in the field. Dr. Jane Thompson, a renowned endocrinologist, shares her perspective. It's perplexing, she says, that the concept of reversing type 2 diabetes is not commonly discussed. Often we focus on managing the symptoms rather than addressing the root cause. This approach might be one of the reasons why the knowledge isn't as widespread. Dr. Thompson's sentiment is echoed by Dr. Mark Stevens, a specialist in metabolic disorders. He suggests there is a misconception that type 2 diabetes is solely a chronic condition. While it's true that it requires long-term management, lifestyle modifications can significantly impact the progression of the disease. However, this information doesn't seem to permeate the public consciousness. Dr. Linda Roberts, a nutritionist specializing in diabetes management, also weighs in. Diet plays a crucial role in managing and even reversing type 2 diabetes, she explains. But it's not just about reducing sugar intake. It's about balanced nutrition, regular exercise, and maintaining a healthy weight. Unfortunately, this narrative often gets oversimplified or overlooked. The recurring theme in these expert opinions is clear. The reason why the knowledge of reversing type 2 diabetes is not common seems to be twofold. First, there's an overemphasis on symptom management and underemphasis on addressing root causes. Secondly, there's a lack of comprehensive understanding about the role of lifestyle changes, particularly diet and exercise, in managing and potentially reversing the condition. So what can we glean from this discussion? It's evident that a paradigm shift is necessary. We need to move beyond merely managing symptoms and start addressing the root causes of type 2 diabetes. We need to illuminate the fact that lifestyle changes are not just adjuncts to medication, but powerful tools that can significantly influence the course of the disease. Moreover, it's vital to bust the myths surrounding this condition and foster a more nuanced understanding of the role of diet and exercise. The onus is on us, the medical community, the media, educators, and everyone in between, to spread this knowledge and bring it into the mainstream conversation. In conclusion, the knowledge about reversing type 2 diabetes is indeed out there. However, it's not as common as it should be due to a lack of comprehensive understanding and an overemphasis on symptom management. But with concerted efforts, we can change this narrative and bring about a more informed approach to managing and potentially reversing type 2 diabetes. Subscribe to the YouTube channel From the Mind of M. for more critical information. Live a healthy life.